Okay, so the next important topic is poliomyelitis, and poliomyelitis generally occurs in an unvaccinated child, and it results in asymmetrical flaccid paralysis, and there is an inability of the child to walk. There will be hypertonia, hyperreflexia can be more pronounced, and these two properties will be more pronounced on one half of the body, and there will be asymmetrically reduced power in the limbs. So there will be asymmetrical flaccid paralysis, and there can be hypertonia and hyperreflexia in one half of the body, and there can be associated muscle pain, headache, nausea, vomiting before the disease, which is called as the prodromal stage. And the possible investigations for poliomyelitis includes clinical examination, which is mostly enough to identify as a case of polio, and there can also be an isolation of the poliovirus from stool swab, and we have to take at least more than or equal to two stool samples at least 24 hours apart, and it is diagnostic, and it can also be isolated from throat swab and also from CSF after 3 to 5 days of illness. So clinical examination, isolation of poliovirus from stool swab, from throat swab, and from CSF. So these are the important investigations. In addition to these, the supplementary investigations include CBC, which will show slightly elevated WBCs, and CSF analysis, which will show initially elevated proteins. So what are the important differential diagnoses to consider in case of a child with polio? Number 1 is aseptic meningitis, number 2 Guillain-Barré syndrome, number 3 transverse myelitis, and number 4 is botulism. So these are the important DDs, and these are the important investigations, and this is the clinical picture of a child with poliomyelitis. So I hope this was helpful for you.